Hello everybody and welcome to our Kids Matter webinar, Getting Help for Deciding When and Where. I'm Sarah, I'm part of the Kids Matter team and it's really great to have you all here. I can see from the chat that there's a few people who haven't been to webinars before, so a really warm welcome to you and also a welcome back to those of you who have been to one or other of our webinars. So Kids Matter is a mental health initiative funded by the Department of Health, and our partners are Beyond Blue and the Australian Psychological Society and ECA, who I work for. Kids Matter provides early childhood services with a framework to guide their service or school or scheme to grow healthy minds at their place. And part of that and integral to that is the professional learning about how to understand more about the mental health of the children and families and educators in their settings. So if you are interested, you'll find as we go some information about the topic, but also some more details about getting your organisation registered and participating in Kids Matter as well. So to start off, I'd really like to acknowledge that I'm meeting on Kaurna country, and I'd like to pay respects to elders past and present. And really thank and acknowledge the contribution that Aboriginal people and Torres Strait Islander peoples have made to our culture and our country. So one of the things that we like to do is encourage you to acknowledge the land that you're meeting on, because we're meeting from all around Australia. So if you would like to in the chat, let us know where you're meeting from and pay your acknowledgement to the traditional owners of the countries that you're meeting on too. The other thing I think that's really important is that that when we talk about mental health and wellbeing, we need to understand it and support it in the context of culture. And think about our own, when we talk about cultural competence, we thinking about the cultural continuum and knowing that we move up and down that continuum as we go. And this potentially influences the decisions that we make about why, when and how we seek help. You'll find that we have some great resources to support understanding about this as well. So today's professional learning focus, one of the things I said was that the Kids Matter framework offers a range of resources, and one of them are these webinars that you can use for professional learning. They're an opportunity for facilitated learning. You get some input from some really great Kerry and Fletcher when they come on, and also there are opportunities for you to reflect on your practice and also on your knowledge, and also an opportunity for you to learn together with other people, and in a chat you can use the chat to ask and answer questions or pose ideas and thoughts. So I really encourage you to participate in this online learning community. One of the things to let you know is that you will receive a certificate for attending today. If you are a participating Kids Matter service, which means that you've actually registered as a Kids Matter service and had a getting started and assigned a facilitator, you can also use this professional learning opportunity as something to help you with your progression. If you, and again, if you'd like to be interested, if you're interested in participating and want to find out more, you'll get some links about that and find out more about that as we go. We're really keen as part of this learning for you to let us know about the things that you've learned or the conversations that you've had with each other back in your services. So if you do have a facilitator, it'd be really great to check in with them or to join one of our other opportunities that we have for us to all learn together. We also need to remember that as we do learn together, we need to make and have conversations about mental health. We need to keep our own well-being in mind and also the well-being of others. So it's really important that we take care of ourselves, we take care of each other, and particularly be respectful and mindful of privacy and confidentiality, particularly if in the chat if you're talking about your service and children and families that you work with. So please be mindful of that. So the professional learning goals that we're going to be working towards today that you will have an understanding or deepen your understanding of mental health difficulties in early childhood. We'll also think about and consider the advantages and disadvantages to a mental health diagnosis and the effects that this can have. We'll think about the knowledge and skills that educators need and people who are working with children need to recognise when there might be a mental health difficulty, and then also to continue to support children who have a mental health difficulty. And the other thing that we'll do is get a bit more of a shared understanding of the educator role, and particularly the boundaries around where our role finishes and where we need to work together with other services or support to address the needs of children who might be experiencing difficulties. So there's going to be a whole range of things we're going to work towards today. And one of the really exciting things is that we're going to do this in a collaborative way, and that you're going to help guide the pathway for this learning. So we're going to particularly focus, there is so much in this conversation, and I guess what we want to do is really bring perspective to this conversation and different points of view. What will happen is that we will make some choices and focus on some particular points of view, but really thinking carefully about children, families and educators, but also our leadership in early learning settings. And that's important because the people who drive or lead early childhood settings may often make decisions about things that happen in those settings. So it's important to consider that as well. We, in Kids Matter, one of the fundamental underpinning ideas is the Von from Brenner socio-ecological model. So if you look at this on screen, you'll actually get a bit of a sense or see some similarities around this. And the other one is the risk and protective factors in terms of mental health promotion, prevention and early intervention. So as I said, we're going to be guided a little bit by you in thinking about whether we explore particular learning goals from the child's perspective, from the family's perspective, from your, as an educator perspective, or perhaps from a leadership perspective. And we're going to do that by using polls. So if you've been to one of our sessions before, one of our webinars before, you'll know all about polls. If you haven't, we're going to have a practice. The one thing about these polls is that usually we offer some choices for people, but today there's going to be, you'll have to make one decision. Now, of course, all of you will probably want to have a go, want to find out about everything, but we're going to have to narrow the focus down a little bit. So we might do the practice poll now. So what's going to happen is that you'll have 4 questions. Are you going to put that up, Cassie, for me? So what I'd like you to do is make a choice and think about which focus you'd like to choose from today. So whether we look at the mental health needs of children from the perspective of the child or the family, from educators or early childhood leadership. Now, while you're doing that, and I know it's a bit tricky to choose one, but that's what we're going to ask you to do, and we'd like as many of you as possible to contribute to that. So just click on the button. I would really like to introduce our the other presenters for today. So Kerry and Fletcher are here, and they're going to offer their knowledge and expertise. So I'll get them to introduce themselves. Kerry, maybe you'd like to go first.
Thanks, Sarah. Welcome, everyone. Yes, I'm Kerry Bidwell. I'm a facilitator with Kids Matter based in Queensland, and I've been working with Kids Matter for about 4 years, and probably in childhood sort of areas in one way or another for the last 10 years, but my background is in psychology predominantly.
Thanks, Kerry. And Fletcher?
Hi everyone, welcome. My name is Fletcher Kerno. I'm the Kids Matter National Health and Community Partnerships Officer, and my background's in community psychology, so I finished my community psychology masters last year, and I've been at Kids Matter for almost a year now.
Great, thank you, and welcome. Really great to have both of you here, because I think the knowledge and expertise that you'll have, people will find it really, really helpful. And it looks like from the poll that people are really interested in finding out about the child. That's really come out really strongly as the area of focus that they would like to consider. So thank you, everybody. We'll just stop that poll. So we're going to have a look at, and we're going to do another poll in a minute. So, but we're going to have a look at this particular learning outcome, which is where we're thinking about gaining an understanding of mental health difficulties in early childhood. So what might be some of the common signs and symptoms? So thinking about this particular area of focus, so understanding, for us to understand mental health difficulties, we're going to do the proper poll, not the practice poll now. And I'd like you to choose again. So thinking particularly about mental health difficulties, which one would you like to focus on? And I think then it's going to be, Kerry, are you going to do some responses after this?
No, that would be me.
Fletcher. Excellent. So there's a bit of backwards and forward thing, but it does look like that the educator, people are thinking, what do I need to know and how do I get knowledge in terms of mental health difficulties for children? Seems to be coming out one of the strongest. So just give you a little bit more time to make sure everybody has a chance. Yes, that's by far looking like the strongest one. So we'll stop the poll there. Thanks everybody for contributing. So you can see kind of now, just before you jump in, Fletcher, people can see how we're going to progress this. So what we're going to do now is Fletcher's going to offer you some thoughts about that in terms of from the educator's perspective.
All right. I'm on Wurundjeri country, so I'd just like to acknowledge the traditional owners of the land where I am too. We've got a fair bit to get through in this section, so bear with me. I'll give a bit of background context and then we'll get stuck into the educator's perspective. So in terms of mental health, early childhood mental health and wellbeing is seen as the capacity of a young child to participate in the physical and social environment, form healthier and secure relationships, experience, regulate, understand and express emotions and behaviour, interact appropriately with others and develop a sense of self. And this occurs within the context of the development, family, environment and culture, which is something that Zara mentioned before. And it's a really critical development period, as you all know all too well. I feel like every time I see my 2-year-old niece, she knows 100 extra words. And this stage really lays the foundation for mental health and wellbeing into the future. So in terms of mental health difficulties, it's really important to remember that most young children do experience good mental health. And fluctuations in emotions and behaviour are a normal part of development. And they often arise in response to change or other common life stresses. And mental health difficulties, a kind of broad definition, is a range of social, emotional and behavioural difficulties that may cause distress or concern. And these difficulties affect children's behaviour, feelings, learning, relationships with others, as well as their physical health and well-being. And while everyone experiences difficulties from time to time, a small number of children's difficulties happen more often and affect them greatly. Sarah mentioned briefly the risk and protective factors. They're a really important part of the Kids Matter model. I'll just quickly mention what that kind of means for those who it's new. It's risk factors for children's mental health increase the likelihood of mental health difficulties developing, and they include things such as trauma, abuse, family conflict, those type of things. Protective factors decrease the likelihood of mental health difficulties developing, and include things like warm, stable home environment, support from a wide range of people, and the list goes on. And Kids Matter has a lot of good resources around these. So when thinking about mental health and mental health difficulties, it's really helpful to think about it on a continuum. So that's ranging from good mental health to mental health difficulties and disorders on the other side. So it's a bit like physical health in that it can range from good to poor across a continuum and can change over time. So a child, for example, that might have some separation anxiety issues might they might be really high at one certain stage, but over time they may swing this way and then may swing back. Something might happen and they can move. So over the course of a lifetime, you can move up and down that continuum. So having good mental health isn't about feeling happy all the time, but it's about being able to experience and express feelings in different ways, to manage those ups and downs, and becoming overwhelmed, and without becoming too overwhelmed, and maintain those relationships with others. So in terms of mental health difficulties on that continuum, we think about them in terms of what they mean for a child's thoughts, feelings, emotions and behaviours. And behaviour is generally what we're able to see. It's obviously quite difficult to understand what a child's feelings and thoughts are, so behaviours can be classified as internalising or externalising. Internalising difficulties show behaviours that are inhibited or over-controlled. They may be nervous or anxious temperament, worried, sad, etc. And externalising difficulties show behaviours that are less controlled. Rather than being able to sit and talk with their feelings, they manage them through impulsive or reactive behaviour. So sometimes this pattern can lead to difficulties with attention, aggression, oppositional behaviour, and these behaviours are relatively easy to recognise, as they're quite disruptive and likely require attention, as you all well know, I'm sure. And mental health difficulties are caused by multiple factors and interact in different ways depending on that individual context. And we could talk about these all day, but basically there's biological factors like physical health or disability, psychological factors like coping skills or self-esteem, and social factors like family circumstances or school environment that all affect children's mental health. And they can either have a positive or negative influence. And something that Sarah mentioned before is that I just wanted to focus on context for a minute. And it's really important that in terms of mental health difficulties, that they can look different at different developmental stages. For example, anxieties, babies and toddlers might fear loud noises, heights, strangers. Preschoolers might start to show fear of being on their own and of the dark. And the same behaviour or emotion may be seen as a difficulty in one stage of development and not the other. And language is also really important here as children start to express those thoughts and emotions. And mental health and wellbeing also can mean different things in different cultures. So if you take, for example, an Aboriginal definition of social and emotional wellbeing, that might look more at the social, emotional and cultural wellbeing of the whole community. And language is also, language issues with parents and carers and children can make it difficult to understand where some challenges may lie. Speaking of challenges, one of the biggest one is recognising signs of mental health difficulties. And so that's deciding when a concern is significant enough to take further action. And generally we like to focus, in this case, when you examine the pervasiveness, frequency, persistence and severity of children's behaviours, thoughts and emotions, and that can help recognise the level of concern present. So in fleshing these out a bit, pervasiveness is the number of settings in which a child is displaying particular behaviours, their emotions and thoughts, and that could be at the service, at home, visiting friends, wherever. Frequency is how often these behaviours, emotions and thoughts are observed. So is it rarely, all the time, certain times through the year, is it after holidays, etc. Persistence is how long the behaviours, emotions and thoughts have been present. So is it days, is it weeks, is it months? And severity, put quite simply, is how severe a child's behaviours are. So are they mild, moderate, severe? And it relates to how much these behaviours are influencing their day-to-day lives. So the more pervasive, frequent, persistent and severe a particular group of behaviours, thoughts and emotions are, the higher level of concern and the greater the impact on learning and social relationships. So finally, mental health disorders. They're a more severe and describe a recognisable set of symptoms and behaviours. In most cases, they're associated with distress and difficulty in functioning, and it typically persists for a longer period of time, such as anxiety or depression, and symptoms may come and go, but may also be short-lived, but typically they persist for long periods of time. They're diagnosed by a mental health professional like a psychologist, and common disorders for early childhood include disruptive behaviours like ADHD, oppositional defiant disorder, conduct disorder, developmental disorders like autism, anxiety, depression and trauma disorders. And they're at the very end of that continuum. And this is when behaviours happen on a regular basis, are distressing to the child and those around them, persist over time, a month or longer usually, and they're across different situations. So from an educator perspective, there's quite a bit to know, and it can be difficult because you might have a child with particular needs, so you develop a great understanding of these needs and how to address them, but you might not ever come across a child with those particular needs again, and every context and every individual is different. So Kids Matter provides a fantastic network to help educators develop their understanding of mental health in early childhood. And it's also important to understand that we can't know everything. We talk about a lot about this thing called connectivism, which is like you don't need to know everything, but needing to know where to access the right resources and knowledge. So another point of contact for building knowledge, like this PD, is mental health and community professionals. So building long-term partnerships can really help this process, where professionals can be available for regular contact. You can start with people like your preschool field officers or local maternal child and health nurses, or someone that's easily accessible to kind of build those professional partnerships out, and that can really help in continuing that knowledge. So I hope that gives you a bit of an overview and from that perspective as an educator. Thanks, Sarah.
That's great. Thank you, Fletcher. I was thinking as you were talking, you know, it can feel a bit overwhelming potentially. And, you know, I think continuing to learn and continuing to explore and continuing to make those connections is really important, and not to be too try not to be too overwhelmed by it, because the more we know, the more confident we feel as educators.
Exactly. Yeah, exactly, and it's a knowledge journey. It takes time, and so yeah, you're right. It's very important not to get overwhelmed with everything at the beginning. So
yeah. But you know, this is a great first step. If for some of you it's the first step, I think it's a really great first step. Kerry, did you want to add anything more, or should we move on to the next choice?
I think Sarah may be acknowledging the really important role that educators do have with young children, and, you know, seeing children every day. I think most educators get a really great feel for what's on the edges of that mental health continuum that Fletcher talked about. So I believe that's an advantage, and I think, you know, educators also have an advantage in terms of those really positive, kind of responsive and trusting relationships with parents. So just feeling confident that, you know, we're in a good position as educators with those relationships to start many of the conversations around mental health difficulties. And as Fletcher said, you know, the more we know and understand about that mental health continuum and behaviour in children, you know, that the better off we'll be. Yeah.
That's great. Thanks, Kerry and Fletcher. So now we're going to move on to that was where we were meant to be, to the next professional learning goal. So this is a point where we're going to have another poll, and you're going to choose the perspective again. So that time we focus on the educator. This time we're going to think about, so we might put the poll up to, again, Kathy, thanks. We're going to think about the considerations and the advantages and disadvantages of a diagnosis. So which perspective would you like to, Fletcher's going to lead us through that one again. So do we want to think about what that means for the parent, or do we want to think about what that might mean for the child, or perhaps for the service leadership, what might that mean? So again, it'll be consensus. This one's a bit closer. So people, and of course, one thing I need to let you know is that when you get your information at the end of this session, there will be information relating to each of those perspectives. It won't just be, just for time's sake, we just need to focus on one for the webinar. So it looks like, again, the educators are going to be the winners. So we're going to, thanks, Kath, we'll stop the poll. So Fletcher, if you could, again, talk about the advantages and disadvantages of the diagnosis, the impact on the family from that educator's perspective.
Yeah, sure. This was the one I was hoping not to get, because it's the one I probably got the most information for, but for participants, I think it will be the best. So we'll see how we go. So kind of building on what I was saying before, after well-informed observation, assessment and understanding of a child, a family, a mental health professional might make a diagnosis, and this diagnosis can have disadvantages and advantages. So in terms of advantages, the first one is the child is actually getting help, getting appropriate intervention. Families can be linked to practitioners who have experience and skills working with a particular difficulty. And it provides a framework and a shared understanding which to understand the child and the disorder and how to support them. Another benefit, which you touched on earlier, is that a diagnosis can help children understand, help other children understand why a child might be struggling. It could also give families a sense of relief and an explanation for their child's difficulties. And some children and families may have been experiencing these difficulties for a long period of time without being explained why. So a diagnosis can really give an opportunity to understand the nature of those challenges and how to support them. Another advantage of diagnosis is the possibility of child being eligible for funding and support services. Many diagnosed mental health disorders, there's government funding available for extra support. It's also really advantageous for children when a mental health diagnosis incorporates inclusive practices in an educational environment. So when an environment is supportive and accepting of mental health difficulties, it can help families, educators, and other members of the service community cope better and feel supported when they're experiencing difficulties. Another benefit is that it can provide families with connection to other families experiencing similar difficulties. And this can really help parents and carers not feel so isolated in dealing with their child's mental health issues and provide opportunities for families to share experiences. We also have medication here in advantages, and it's also a disadvantage, but it can be beneficial, but is really a long-term solution and needs to be provided in addition to and not instead of psychological and social support. Diagnosis also can help with transition to school, and really kind of giving good documentation about the child's history and challenges and strengths. And finally, a diagnosis can provide hope. Coordinated support of families, educators and professionals working together can help provide realistic expectations, supportive environments, interventions that can help the child move down that continuum. Okay, so environments, interventions that can help the child move down that continuum. Okay, so in terms of the disadvantages, the first is that diagnosis can give the child a label. It can put them in categories. We really have to be mindful of this and the boundaries. The second disadvantage, and probably the most impactful one, is stigma and discrimination. Stigma is a perception which identifies a child as different due to a characteristic considered to be undesirable. So in this case, a child might be seen as abnormal or seen as the disorder, not an individual, and this can lead to discrimination. Diagnosis can also lower expectations, and labels can shape expectations of parents and educators. So research actually demonstrates that beliefs about child's capacity is directly related to their achievement. And another con is that diagnosis can influence people to jump to conclusions about a child or attribute their behaviours to the disorder that are actually unrelated. So all kids have some problematic behaviours, obviously, and labels can exaggerate a child's actions in the eyes of adults, as well as people can make assumptions based on that diagnosis. Related to this is the disadvantage that suggests that children have the same diagnosis all show the same characteristics. This goes back to that ecological model and thinking about context, and that every child is different, and that no child, even with the same diagnosis, is the same. And also children who are labelled with a difficulty may feel unintentionally isolated, and that's why inclusive environments are so important. And parents and carers can also go through a grieving process when a diagnosis is given, and can feel guilty or to blame for their child's difficulties. And finally, medication for a diagnosed mental health disorders can have various side effects and can make issues worse. So again, the decision to use medication should be taken with care and caution, and should be not used as first thought, and needs to be used in conjunction. So they're the main pros and cons of diagnosis. Fundamentally, a mental health diagnosis is useful, and it's a way for people to communicate a collection of difficulties and symptoms and have a shared understanding. So having a mental health diagnosis, let's take depression for example, will help educators and families get together and understand it. That the child is feeling really flat, not motivated, and sad a lot of the time. We also need to be aware of the cons of diagnosis, and it might not be the right thing for families. So we've got to take, as educators, a balanced approach with families. If you do happen to find yourself working with a child who has a mental health diagnosis, remember that your interactions with that child are still going to be just about how that child is and their relationship with you. And the way you communicate with them will depend not on their mental health problem, but how you relate to them normally. And it's really important that a child, isn't seen as their diagnosis. And we've got to be really careful about labels, but, they're seen as Jimmy, as Susan. They are not the diagnosis. And with or without a diagnosis, support for the child is the most important thing. So from the child's point of view, it's very much around nurturing a relationship. So as an educator, being clear with parents and explaining that there is a concern about the child and you're looking for ways to support them is important, but it needs to be obvious that we're not blaming or judging, but actually advocating for that child. And early childhood educators, parents, and health and community professionals, when they work together in a coordinated way, that's when we kind of get the best results. And a kind of a common hurdle relating to diagnosis, and I'm sure some of you would have come across this before, is when parents are not ready for that diagnosis, and there is a mismatch with educators. This can be due to things like lack of developmental knowledge, that grief relating to their child possibly having the diagnosis, or parents being aware that there are problems, but it's hard for them to accept. So this process needs to be managed carefully, where genuine concerns are discussed, but in a way that doesn't blame or judge and respects parents' knowledge. So things like it can be helpful to make sure that in preparing for these conversations that the child's strengths are also explained, giving that balanced approach. It can help ease the conversation of discussing difficulties. It's also worth noting being wary of discussing concerns and strengths at a hurried or distracting pickup time. So mentioning someone's concerns carefully to prepare them, but then scheduling some time to actually discuss these in more detail. And it can also help to really know parents and know what's important to them, academics, for example, and that way you can kind of put our conversations and concerns in the context of what the parents value. So explaining the impact on concentration and learning, for example, if they've got a strong academic focus. And it's also important that educators look after their own mental health too and engage in those self-care practices. And Sarah mentioned that before, because these conversations can be really taxing and distressing. But ultimately, it is the parents that make the decision whether to see a mental health professional for a diagnosis. So as educators, we need to respect parents' final decisions and their boundaries, which Kerry will try to talk a bit more about in a bit. And building those relationships of trust with parents and carers is vital to help them understand that educators have a genuine care about their child and are doing the best for them. So educators and family can work together to extend those relationships to professionals as well, and so that they can work together. So from an educator's perspective, suggesting someone seek support for a diagnosis comes down to that relationship. That's really important, and it's really respecting parents' knowledge as well as the child's strengths and being aware of those possible disadvantages. Thanks, Sarah. That's me done.
Thanks, Fletcher. Kerry, I'll get you to jump in here too, but I was thinking as you were talking, Fletcher, about, it was really important because sometimes this can, again, I'm going to say that word overwhelming, and educators really want the best for the children they work with, and, those points about the relationship and how important that is and responding to children based on who they are, the individual child, regardless of whatever, labels or diagnosis. I think lots of educators have that at their heart. And then when you try and engage with a family and it's difficult to do that, that feels really hard and it feels like you're not doing your job properly, and if only they did, or if only, and it's really important not to do that, because that adversarial kind of way of being together is really unhelpful for the child. So yeah, that's what I was thinking about. Kerry, do you want to add anything?
Yeah, thanks, Sarah. I think Fletcher covered a really great list there, particularly talking about some of the pros and cons of diagnosis, and just understanding that's really, really helpful. I was thinking about some of the conversations I've had with educators as we've travelled through the sort of the Kids Matter journey, and that scenario, Fletcher, that you mentioned around parents not being ready is a really common one. So typically you might have a child entering a service and quite quickly, either at the beginning of the year or you know, not long after, that educator may already be thinking or have some concerns around that child if they're, you know, if those behaviours are starting to show themselves. So already they may have picked that up, but having that conversation with the parent can be a different matter, and I think requires quite a, you know, quite a set of skills around communication, and one that we often learn in the job, I think. So that's a really important area just to acknowledge. And that whole idea about early intervention, you know, like typically in most services you probably have a group of children who have a diagnosis in any one group, but you may also have, you know, several children that have not received that diagnosis, even though perhaps some educators may think that that would be a better way to go. So typically most of the time we're working with both you know, both scenarios, and as Sarah mentioned, you know, it's about, you know, working with the whole child and with that family to get the best outcomes for children no matter what. So that's something that educators are really good at. Yeah. Right, we could talk about this for a long time, couldn't we? Let's move on to the next one though. So much to talk about. So the next learning goal, which and Kerry's going to walk us through the next two. So again, you can choose the focus. So again, we've had the educator perspective twice now, but this one again is thinking about the knowledge and skills to recognise and support children who are experiencing mental health difficulties. So we might pop the poll up and we'll again choose the focus. And you know, really thinking, I guess this builds on from the first one we were talking about, understanding what mental health difficulties are. With a child, the child actually might be needing someone bigger, stronger, wiser and kind, someone who has got those skills and understanding of what mental health difficulty might be, but also those skills that you were talking about, Kerry, in terms of being able to connect with families, and also the ones you were talking about, Fletcher, being able to make those really good links with, you know, beyond the early childhood context. So, but again, it looks like the educator, people want to know about how that's going to work for them. So, you know, absolutely, that's why you're here, I guess. So that one's pretty clear. We might stop that poll now. So Kerry, we'll hand over to you, and you can. Thanks, Sarah. Just reflecting on this whole area of, you know, what kind of knowledge and skills we might need to recognise and support children. I think there's a whole range of skills and abilities that we learn as educators in our job that are really important. And again, I think the key message here is, I guess, that we're all part of a team, and that we don't necessarily need to develop all of those skills all at the same time, that there's a lot of supports around us. And so that's a really key message, I think, right from the start. But I just wanted to reflect on a couple of things, again, that I think are really important in this whole area of mental health, in terms of knowledge and skills that will assist us, you know, and things that we might like to think about. How do we sort of fare in our services if we were to look at those skills, and do we need to strengthen some of them? And some of them, I think, are also about maybe, you know, the attitudes that we may have, or our philosophies in our services, and the values that we might look at as well. So often we can't necessarily separate those values and attitudes, you know, from the knowledge and skills area. So I guess the first thing I wanted to mention was, you know, just acknowledging that, you know, having a philosophy that prioritises mental health from an educator perspective, or a leader perspective even, is really important. And so we might ask ourselves, is mental health a priority in our service, and how do we actually make that really visible? You know, is that reflected in our statement of philosophy, in our vision, in our goals? and values, and how do we actually work with parents to achieve that? I think that, I think that's really important. The culture that we have in our services is also really important. So do we have a really inclusive culture, and do we value help seeking? Is that something that we try and encourage with our staff as a team, and with the parents that we work with as well? So what we're trying to strive for, I guess, and what we know are protective factors for children is, trying to strengthen that culture of belonging, where all families feel welcomed and acknowledged, and where different cultures might be visible in our service and part of our early childhood community. And I guess where we as educators and leaders, that we also model that kind of inclusive and welcoming practice as well, but that becomes really visible in our actions and the way that we work together and the way we communicate with parents. And also a culture around accessing support early. So Fletcher mentioned, the importance of early intervention and help seeking, and I think, that is something that we really want to try and work on consistently. So we've talked a little about that holistic view of the child, and educators making a commitment to that holistic view and seeing the child as a whole person, not necessarily the problem. Educators, I think, who do well in this area really source a lot of information around how children are experiencing the context of the early childhood setting, and they do that with a whole range of people. So that could be, starting to look at children themselves through that observational process, or it may be that educators talk to families, and they may also talk to children themselves as well. So we're really, starting to adopt that community approach around the notion of wellbeing and mental health, and that it's not a one-size-fits-all. We touched on observation and reporting skills, and I think these are really critical. We do a lot of this as teachers and educators in services, and this includes being able to closely observe children's behaviour. Often it's about identifying triggers that might contribute to behaviours that we may be concerned about, and it's looking at children's emotions and feelings and understanding those emotions and feelings in the context of, when children may not be able to explain that or talk about that, but we see that in their behaviour and how they're interacting with that behaviour. And also the reaction of carers and adults and how these might be impacting on behaviour as well. So that's all part of that observational process, and really assists in the whole identification, I think, and what we need to be doing when we do have concerns. And one of the ways that we can take that next step, by using our observations is, they become then the basis for those first conversations that educators have with parents. So we can talk about, what we've noticed about the child, how frequently or severe the behaviour might be, how it's impacting on a child's functioning, how that child may be coping emotionally. And those observations provide really essential information also for health and other community professionals when a referral is made. So that's, that's a really great bridging, skill, and there's knowledge there, I think, that we can really draw on and share that can facilitate that process. I think the other skill that I find is really important, and one I'm continually working on, even years down the track, is around skills in communicating with carers and families. And part of this, when we're thinking about mental health conversations, is that often we have to navigate very difficult conversations with parents at different times, and maybe our own team members as well. So supportive communication, and I think, developing and getting strong in those areas around having those difficult conversations can really help and assist families to feel at ease when they're often, you know, it may be triggering things for them, or they may become upset or defensive. You know, knowing how to handle that and how to diffuse those really strong emotions that we might observe in parents. You know, that's quite a skill, not to be underestimated, I don't think. Particularly for families where, you know, they may be going through a grieving process, or they may be affected by trauma. Sometimes we describe those families as tricky or challenging. So that's, you know, that's particularly where we might need to focus on, you know, that knowledge and skill. I think another one, we've touched on it, is around self-awareness. So developing skills and knowledge in, you know, being able to tune into our own emotions and reactions, and being aware of emotional triggers and some of those hot buttons, you know, that's a skill too. So when we can get good at being able to do that and develop that self-awareness, we're often in a position to be able to support children and families a lot more effectively. Understanding the emotional needs of parents and tuning into parents, and, you know, being able to manage some of those strong emotions like anger and withdrawal, etc., is, you know, is a really important area, I think. Another set of skills that I think educators do really well in is the whole area of advocacy, and so this can help, you know, build some bridges in terms of supporting children with mental health difficulties. And advocacy can mean different things to different people in different services, but often it starts by understanding a child's strengths and their needs. And sometimes that may be about, you know, funding decisions in order to support that child's needs, or being able to, you know, having knowledge around where do I go for funding support. But it also might be around advocating by liaising with a range of health and other professionals to support children and families. So those, you know, those advocacy skills can really make a big difference, I think, in terms of support for families. And Fletcher mentioned, and also Sarah earlier, around things like self-care. That's a really important area, looking after yourself, managing your own stress and anxiety. So some conversations, again, that I've had with some of the directors or educators in services, you know, some of the advice that, or maybe some of the feedback they give me, is that I've really had to learn how to not take things personally when I deal with families who may be under stress. It, you know, it's being aware that that's not always about me, but perhaps you know, about how a parent is feeling at that point in time. And also understanding that we have, you know, we have our own needs as educators or leaders in our services to develop our own support people or group, and someone to vent to when we need it, and, you know, someone to be able to debrief with at times as well. And just to wrap up, I guess, you know, from a professional learning perspective, I mean, we're learning all the time about mental health and how to support children and families, but being able to take responsibility for upskilling and developing our own knowledge, you know, I think that's a process that educators are quite good at. They're very motivated, you know, to take that next step in terms of, you know, building on their professional learning and skilling themselves in different areas. So seeking out further support is something that we just do as educators continually, I think. And that's often about acquiring sufficient knowledge around mental health difficulties as needed. So we might need different things at different times, you know, depending on children. I think that's, you know, again, the key message is around early intervention here as well. Thanks, Sarah.
Thanks, Kerry. You know, I was thinking as we were talking, you know, how significant and important reflective practice is in this as well. And that's part of that professional learning, that, you know, really being able to reflect either by yourself and or together is probably a really important skill to really practice and develop in this space as well. So Fletcher, just before we move on, and I am a bit conscious of time, have you got anything else you'd really like to add about the knowledge and skills we might need?
No, not really. I think Kerry covered it really well. Lots of skills in terms of observation, diffusing those strong emotions with families, and those advocacy skills that she mentioned are all, really important and take time to develop.
Yeah, great. Excellent. All right, well, we'll move on to the next poll. So this is our last professional learning goal, and this is about boundaries. So really thinking about where our role as educators start and finish. And I think you talked about a little bit before, Fletcher, about, those connections that we have with other people who might be involved in supporting the child and the family as well, and also us. So we might pop the poll up. So which focus would you like to have? Are we going to go with educators again and think about what it's like for us, or leadership jumped in there at the beginning? Looks like it might be an educator focus again. I think it was really interesting. I think, Kerry, you talked a little bit in the last one about how important the culture of the service is. And so obviously when we're talking about educators, there is a really strong connection to the leadership of an organisation as well, being able to implement some of these things. Okay, looks like educators again. We want to focus on what it's like for us. Fabulous. All right, we'll stop the poll and I'll hand straight over to you, Kerry, so we can get straight into this one.
Okay, thanks, Sarah. So I guess in this area where, we're really looking at, having an understanding of the educator role and boundaries. So I guess to simplify this, the role and job of an educator in early childhood communities, it's really about, protecting that space for children to flourish. And often that's around developing positive relationships with children. And I think educators do this really well on the whole. So also acknowledging that early years services are one important component, but there does need to be other things going on in that child's world that are helping to support. So we might ask, how do early years services integrate with other services to provide a more cohesive and joined up delivery for families that are really struggling? And it's not all about, one person, taking on a support role. Again, it's about a team coming together with shared strengths and perhaps different roles that might operate, in an early childhood service. So I think, having a look and examining those relationships and connections that we have with other services like family support, child protection, adult mental health, they're all really relevant as part of that support role. And they do help to, I think, define some of those boundaries. Sometimes I think when we talk about boundaries, we tend to, jump straight in and think about more traditional ways of working in early childhood services, in that, when we find that we're working with a child or a family who has complex, emotional or behavioural needs, that we might automatically think about, well, what external providers, in our community are there to support us. But in fact, there's probably lots of different options, that we can explore, and lots of services that I talk to who are implementing the Kids Matter framework have been really creative and used resources in a really creative way to support children and families with identified difficulties. And what that's done is been able to, I think some of those boundaries might be a little blurred, but in fact, it's all sort of come together to be quite integrated in the support that we can offer. So I thought I'd just spend the next 5 minutes or so just reflecting on some examples and some of the ways that some of our Kids Matter services have actually being able to bring in support and roles and work around that whole area of boundaries in a really flexible way. So one example I wanted to talk about was to one service that we have in Kids Matter actually looked at employing a family support worker within their service to, you know, to facilitate parent intervention and to really support families. And what they were able to do was to respond to the identified needs of those families within the service and support those families most at risk. You know, that was one of the aims. They were able to assist families to understand child development areas and work collaboratively with those families to strengthen parenting skills. And we know that's a protective factor, being able to strengthen those parenting skills. And also to provide, in essence, an early intervention bridge for families. And if you want to know a little bit more about that story, I guess in our resources, we'll send the link through, because that story is actually published in our Shared Thinking blog, and it may be really interesting for some of the participants of the webinar to go back and read a little more around that. So I just wanted to read out part of that story from the director of that service, which is a long day care service. Our exploration of Component 3 professional learning topics further highlighted to us how supporting parents also supports the mental health and wellbeing of children. And it also empowered us to recognise that we had to do more. This led us to employing a family support coordinator, someone willing and able to help parents spend quality time in one-to-one interactions with their children, someone who can provide a connection to families and community and its many resources. And that's available to our parents during times of crisis or need. And we also developed a playgroup for parents to support families who may be financially or socially vulnerable or isolated. And this network of parents meet weekly to support each other through tough times and help each other with parenting tips and ideas. So that's just one way perhaps that we can think about boundaries and what is our role, you know, where do some of those supports exist in our community. Sarah, I'm just aware of time.
Yes, I was going to say to you, Kerry, I know you had some other suggestions, but we might need to move on.
Yeah.
And like, as Kerry said, I popped the blog link to the blog in the chat, but you will also receive some information at the end or in the coming weeks, week or so, with some follow-up information. So you'll hear some of those other stories that Kerry was going to share with you as well. But I think probably your main message, Kerry, was there's no one way to identify the boundaries, but there's lots of different ways to think about how you might. But having boundaries is important. I mean, I guess that's the main message, isn't it?
Yes, definitely. I think, and you know, what's available in our communities, and perhaps how do we explore those sort of support options?
Yeah. Now, one of the things that we encourage you to do is participate in our online learning community, and we do have a blog post for you to think about what you're going to do next. So if you are interested in participating in this now, you can click on the screen and it will open up in a new browser. However, I'm not going to spend too much time on this because I know that we're running out of time. So again, I really encourage you to share your stories on our blog post. So I've noticed someone in the chat has used the Beatles tool and it's been really helpful in moving forward with a child. So, you know, all of those stories would be really great to hear and we'd love for you to share them in our chat. So again, you will get a copy of this, you'll get a link to this. And this blog post will also be where the copy of the webinar recording goes up at the end as well. But I do want to move on and just to kind of, I guess, think about and do a bit of a recap and perhaps hear some last minute thoughts from Kerry and Fletcher in terms of, you know, so we've covered these two topics, these two Kids Matter professional learning topics. And we really strongly today looked at it from the perspective of us as educators. However, I was really mindful and noticed that Kerry and Fletcher both added those other perspectives too. So the health and community, the child's perspective, but also the family's perspective. And I think it's really helpful when we do some learning that we don't only think about it from our own point of view. It's really important to do that and to develop those skills, but you know, to really be mindful that there are other people in this and that we need to think about what it's like for them as well. So just to, what would your final takeaway message be, Kerry? And Kerry, we'll go with you first.
I think the final takeaway might be just to remember that we're all part of a team, that there's many supports out there. Early intervention, it's probably better to act early so that we can make changes to maybe children on that mental health trajectory, and often that can make a big difference.
Right, and Fletcher?
Yeah, I'm going to echo very similar things in terms of working together to have that coordinated support, thinking about the cons of diagnosis when working together, and putting the child's needs and intervention at the centre, and yeah, having those conversations early, like Kerry mentioned, are really important.
Right. And I'm really sorry to rush at the end here, everybody, but remember that we've got some more webinars coming up that will build on this. I'd really like to thank Kerry and Fletcher for their amazing words of wisdom. The chat just went quiet because everybody was so mesmerised and so engaged, I think, and someone said it's been so much to process. So grab the recording. You'll be that'll get sent to you, emailed to you, so you'll have a chance to go over it again yourselves, and also to share it with your team. And if you want to find out any more about Kids Matter, about becoming part of the Kids Matter experience, please get in touch with us. Hang on the line because we really want to get your feedback as well. So, and remember, if you joined with other people and you all want a certificate, you need to make sure you enter everybody's name. So thank you once again. I'm really sorry to rush it at the end there, but thank you once again, Kerry and Fletcher. And I thank everybody else for participating and for coming along, and also for doing such a great job with the polls, because we hadn't tried that before, but I think it worked really well. So really like to thank all of you, and say goodbye to you all. Thank you so much for coming.